So, disclaimer, I'm not a doctor, not a physician, um, I'm not a nutritionist or physical therapist, never trained in those areas, and I have not consulted with anyone on the subject. It's purely observation and personal experience. So, let's talk about chronic pain. Chronic pain is pain that is persistent over an extended period of time versus acute pain, which is more short term, like a pain from a cut or a bruise would be acute pain. Chronic pain would be pain from arthritis, or any other long-term, long-term painful condition. Even some cancers can have chronic pain. I was already planning to have a video about chronic pain, but the reason I'm actually doing it today is because I woke up this morning and my shoulder here was incredibly painful, and my left knee was very painful, and my left hip was very painful. I slept on my left side, which was a mistake, because I know I have chronic pain issues on my left side, but especially the shoulder. And that was because when I was a kid, my silly horse Bonnie tossed me while I was riding her, and I ended up hitting the fence post and actually broke my humerus right up here. And no, it wasn't funny. And actually displaced the bone a little bit. So of course they couldn't put it in a cast, and they weren't going to do surgery on it. There wasn't any way for them to really stabilize it surgically because of the location of the break. They couldn't put a pin in, they couldn't put plates. There was no reasonable way for them to fix it with surgery. So I ended up being in an arm sling for 2.5 months with my left arm across my torso like this, and just immobilized for 2.5 months. And as it healed, of course, 2.5 months of very minimal, almost no use of it. The muscles of my rotator cuff up here atrophied, or essentially shrank because of lack of use. So it took several months, even years of physical therapy for me to even get remotely full range of vision back, or motion, not vision, back in my left shoulder. But it didn't prevent arthritis from happening. And that was just a result of the fracture healing. Because of the nature of the break and how it ended up being displaced, it caused excess bony growth in it that my body has not removed. And because it has that extra bone volume there, it causes pressure on the blood vessels, on the muscles, on the nerves in it. And so that's been bothering me for, 11 years? Something like that. And it kind of comes and goes as some forms of chronic pain do. Not all. Some chronic pain has been known to be constant. But one thing I've observed personally with my own chronic pain, and it might or might not be true for other people, is that I could go days, even weeks, without feeling it, and then I sleep on my left side and suddenly, bam, it's there, and I don't want to use my left arm anymore. Now, I have chronic pain in both of my hips and both of my knees. Related to when I was a kid, I learned how to ski when I was 2, and I've been skiing ever since. So over 20 years, yeah. I'm not going to give my exact age. Not that I'm shy about it, but so of course, over those 2 decades and change, I've taken more spills than I count. I've never counted how many times I've fallen. Some worse than others. Some I literally just flopped over sideways because I tripped over my own skis or something. Um, some of them I have actually fallen down the side of the mountain. Not down the whole mountain, of course. I ski at ski areas within their boundaries because I'm a wimp. Actually, when I did fall all the way down the run, it was about I didn't fall the entire half mile. The run itself is about a half mile from top to bottom. More than that, but I didn't fall down the entire run. But that was a double black, which aside from double black EX, which is extreme terrain, is the most difficult category in all of North America or just the United States. I'm not sure. So kind of understanding the nature of my injuries, and not just from skiing, but from various sports, bicycling, of course, horseback riding. I did some equestrian vaulting. If you'll see, I have the 2 complete equestrian vaulted videos on my channel. That was my old vaulting team. Yes, we do stand up and jump on the backs of large moving horses. And you can imagine falling from that height, it can hurt. We do practice, vaulters in general practice, safe landing, safe dismount, or safe recovery. Safe falling. It's a big practice of it so that you don't get hurt, or at least minimize any damage. Unplanned dismounts don't always, you can't always recover from those easy. And even planned dismounts can go wrong. And I have ended up hurting both of my knee. Well, that really exacerbated already the damage to my knees. Even just landing, normally off of them. So basically the point I'm trying to make there is that chronic pain can be worsened through repetitive impact or repetitive damage to an area. To the point where even acute pain can become chronic, just with the repeated damage to it. So, something that was healing, that was going to go away, now might not ever go away. Everyone in my family suffers from chronic pain simply because we are an active, athletic family. My mom has constant pain in her neck and her back because of injuries in the past. That the spinal column itself already is a very, I wouldn't say it's particularly more injury prone than anywhere else. Actually, I think probably the most injury prone area in the human body might be the hands or the head. I'm not an expert on it, so I don't know. That's just my personal observation. So it also depends on your age and your health, and again, especially the nature of the original injury, or condition, as in the case of some cancers and some other health conditions. But my mom actually had fractures in her neck and back. Yeah, not at the same time, no, but and has herniated discs in her neck and back. And they're the intervertebral discs. They're your spinal discs, and they're in between every single bone in your neck, in your back, and even in your tailbone. designed to, cushion the bones and the spinal cord. If you rupture one of those or herniate it, that puts pressure on the spinal cord, and that leads to pain in other areas of the body because you only feel things on your nerve endings. So, like my dad had a herniated disc in his back. In his lower back, and he feels that pain in his foot because the nerves that have the pressure on them end in his foot. So that's where he's feeling the pain. So when that foot hurts, he knows that there's something up with his back. Um, and then I am aware that some cancers and cancer treatment, depending on their nature and progression of the disease, can cause chronic pain. I've never personally experienced it myself, and I haven't spoken to anyone who has. It's something that I've been made aware of through, sort of anecdotal things. Like when I used to watch the Discovery Health channel a lot when I was younger. And they would have programs, sort of highlighting that sort of stuff where, people, talking on the radio or TV or like things about it. Like, so it's information that I've heard, but not personally. I haven't heard of, like, in person from someone that I know. So I don't really know how severe that pain can get. And again, that could be acute pain, which is the, short term, kind of starts suddenly, or that could be chronic, depending on the progression and severity of it. And so I'm not 100% sure if this really counts as chronic pain, but someone who suffers frequent migraines, I think that might be considered chronic pain. I'm not sure about that. But it could. But I mean, a lot of your, hardcore athletes who, football players especially, they get a lot of, head injuries, spine injuries, leg injuries, and shoulders, of course. And because of the nature of, their sport, they're gonna, in general, just from impact, get a lot of repeated injury and damage to their bodies, and that ends up with long-term chronic pain. A lot of contact sport athletes end up with chronic pain just because that's the nature of the sport. So yeah, like wrestlers, boxers, martial artists, they end up with chronic pain because of repeated injury and damage. So you have your footballers who take ice baths. That actually does help reduce inflammation and helps prevent the pain from flaring. Cold packing an area. The cold actually, it causes vasoconstriction, so your blood vessels actually get smaller to reduce blood flow, and that causes a decrease in swelling and inflammation, and therefore, when that pressure is relieved, that pain is relieved as well. One thing to be aware of in acute pain, the inflammation is very important because that's bringing increased blood flow and increased healing. They're actually called healing factors. I learned this in my anatomy class in school. It's actually called healing factors. Not like, Wolverine or Deadpool or superhero healing factor, but it's called healing factors. They're just like, nutrients and, molecules that, go towards resolving damage. If you get punched in the face and your jaw swells, that inflammation, while it is painful, that's acute, and that inflammation is important to heal it and actually prevent chronic pain. Now, of course, if you repeatedly get punched in the same place over and over again, that will lead to chronic pain, and that swelling might not resolve. That's when the inflammation becomes unnecessary because it's not healing it anymore. It's just there. That's when you get, arthritis and your chronic pain. And that's when you really want to use, like, I wouldn't say immediately go for an anti-inflammatory because you can actually, well, it's been shown that you can't really develop a resistance or tolerance to it. You can, depending on what it is, could possibly develop a dependence on it. I think the first thing you want to go look towards is nutrition. Fish oils, vitamin C. That for our animals in my job. Again, I'm a veterinary technician, veterinary nurse, certified. I went through the program, got my certification through the National Veterinary Technicians Association. We recommend for our patients with arthritis and chronic inflammatory conditions, and it is also recommended by doctors, human physicians too. Vitamin C complex with like rosehip. That's highly recommended, and also fish oils, omega-3s and omega-6, which I do take a fish oil supplement, and that does actually help a lot with reducing the flare-ups of my pain. So that's something that I can attest to from personal experience. Again, I'm not a human nutritionist. I'm not a doctor. I'm not a nurse, veterinary, but no, I'm talking about people. So that's my personal experience, and also that was actually recommended by my own physician to help not only with chronic pain but other things with that's not this video's subject. I'm trying not to ramble here. But vitamins and minerals and nutrition are very important to healing, and chronic pain can be lifetime. I think it's going to be lifetime with me, but chronic pain, it can be resolved, or at the very least treated to the point where it's no longer an issue so much. Again, it might or might not go away. Arthritis is generally for life. I don't know if osteoarthritis can ever really be resolved. I'm not sure about that, but there are some chronic conditions that can be resolved. I can't say for sure what they are, and I don't even know really 100% if it is true. Again, I'm no expert on it. But it doesn't have to be debilitating. I mean, when I first broke my arm, the acute pain of the fracture itself was not debilitating, but I would say unbearable. And when I first got it out of the sling, my shoulder could barely move because of the loss of muscle tone in it here by rotator cuff. So I had to go through physical therapy to get that back, and to even get full range of motion back in it. And even that's still kind of restricted because of the bony mass of the osteoarthritis. Now in my knees, actually I just saw a client yesterday who doctors wanted her to have a knee replacement. She's actually been taking chondroitin, which helps actually rebuild cartilage in your joints, and her knees are no longer so painful. That's a big nutritional thing. Again, chondroitin, the root chondro is cartilage. It's Latin. So you take chondroitin, it's essentially a cartilage supplement, cartilage promoter, and chondroitin is the building block for cartilage. So that actually repairing the cartilage, the damaged cartilage in her knees, helped resolve that pain. So that's kind of a key to the importance of nutrition in recovering from chronic pain. So it's just a few things to think about. I hope that you don't feel like I've wasted your time, and I hope I provided a little bit of insight in chronic pain, the process and kind of treatment of it. Again, nutrition is important, and you don't really need to go right towards painkillers for it. If you focus mostly on nutrition, from my personal observation at least, it really helps resolve things pretty quick. I hope any information here was helpful. I'm sorry if I rambled a bit. But yeah, take care out there.